I think that's us.
Yeah.
Okay, good morning, everyone. Lovely to have you this morning, and thanks so much for choosing our workshop on collaboration and partnership. And we're going to be looking at this morning for a short time a case study on the volunteers in the vaccination centre programme that we were involved in. And I'm joined here this morning by my colleagues from the Ulster GAA and British Red Cross, and I'm from Volunteer Now. And we will all be contributing to this presentation this morning to sort of give you an overview of our experience of working in partnership around the vaccination centre piece. So we're delighted that you chose us this morning. Although we can't see you, I know that you're there, so please feel free to pop any questions or any comments that you might have in the chat room. We will do our best to keep an eye on them and to respond if we could. So we have about 45 minutes here this morning. We'll do a formal presentation and then we will answer any questions that you might have in the end. We're also got technical support from Louise here this morning. So thank you, Louise, for being our backup and showing the slides. And if you wouldn't mind then moving to the next slide, please. As I said, we're 3 organisations involved in this particular piece of work. My name is Lindsay Armstrong and I'm Community Projects Manager at Volunteer Now. And really, I wanted to spend a couple of minutes to give you a bit of an overview of us as an organisation, just in case some people aren't familiar with the work and what we do. So Volunteer Now, we are known as a part of the regional infrastructure for volunteering in Northern Ireland. And obviously it's our conference that we've put on today and we're delighted that so many people have attended. And really volunteering is at the core of every part of that is around working with voluntary sector, community sector organisations across Northern Ireland in terms of good practice. So we're there to provide support and help to those organisations who wish to involve volunteers. And part of that is about providing one-to-one support or group support. We all form called Better Impact, or Be Collective, sorry, I should say. And our Be Collective site really is looking at those volunteer involving organisations having a platform where they can highlight their volunteer opportunities, and that's for opportunities across Northern Ireland. And as a member of the public, you can go onto that platform and you can search for a particular volunteering activity that you're interested in, and it will link you in with all the opportunities on that platform and hopefully match you with a volunteering opportunity that's suitable. So we do lots of that kind of work, but my side of the house, community projects, is really around support for very vulnerable older people. We're funded through the Belfast Health and Social Care Trust, and that is to deliver a range of volunteer-led services for older people who are referred on to us through the trust. So people that maybe need shopping support, a volunteer befriender, or a volunteer driver to take them to a medical appointment. So we link those older people with volunteers who can provide that service for them. And it's an amazing project that's helping those people who are really feeling very isolated and lonely, and it helps them stay connected. We also provide a lot of capacity building work for older groups, particularly within the Belfast area. And that is really to encourage and support older people to continue to be engaged in their local community through volunteering for as long as they possibly can. And that's fantastic because it keeps people engaged, it keeps people connected. And just yesterday, we were having a volunteer celebration event for our senior citizens forums in Belfast to sort of thank them for the work they've been involved in for the last 18 months and trying to keep those groups together and during very difficult circumstances. We also have an events project, which is what I manage, and it's really looking at involving volunteers at kind of large scale events. So things like, if you remember the world pre-COVID, when we had large scale events, and the last one we had was the 148th Open at Royal Portrush, where we involved over 250 volunteers as meet and greeters, as volunteer ambassadors for that event. And we've done that with quite a number of large scale events over the years, from World Police and Fire Games in 2013, all the way through to present day, to lots of golf, the marathons, all those kind of events where there's a volunteering element. And so Volunteer Now comes in to recruit, support, train and manage those volunteers for those particular events. We also have Volunteer Now Enterprises, which is our training arm, and that is really where we deliver a lot of our good practice training. So lots of volunteer management training and our safeguarding training, both for adults and for children as well. So as an organisation, we do lots of different things. We will delve into the work of the vaccination centre stuff as we go along. But I'm going to introduce you to my colleague Lea, who's here this morning from the British Red Cross.
Good morning, everyone. It's a pleasure to be here. My name is Lea Karczewski, and I'm the Senior Emergency Response Officer for the Red Cross. And it's great to be here at the Volunteer Now conference. Red Cross helps millions of people in the UK and across the world prepare for, respond to, and recover from emergencies, disasters, and conflicts. You might not know, but we're part of a global Red Cross Red Crescent movement, of which there are over 200 national societies across the world. Red Cross responds to local emergencies such as power outages, floods, traffic incidents, and also more major incidents such as protracted climate-related emergencies, snow and ice, and of course, the COVID pandemic. Over the course of the last 2 years, we have increasingly been providing mutual aid to our colleagues across the UK, such as the Afghan resettlement scheme. There's Tughaven recently as well, and I'm currently providing mutual aid with Storm Arwen, which has impacted Scotland, if you don't know already. We provide practical and emotional support to people in the immediate aftermath of emergencies and help them to start rebuild their lives in the days following an incident and emergency. Across the UK, we have around 20,000 volunteers, and locally we have opportunities in retail, mobility aids, our refugee services, our independent living services, and of course, where I come from, emergency response. In emergency response, our local volunteers, they would respond to more things like fires, missing persons, agricultural incidents in the rural areas, suicides, fires, and severe weather. This year alone, and we're not quite there yet, we have responded to 105 instances where we've deployed 224 emergency response volunteers and their vehicles. And these figures don't include all the work within the partnership with Volunteer Now and the Gaelic Athletic Association over the COVID health crisis. In Red Cross, we work to 7 fundamental principles, including humanity and neutrality, and also a set of values that encourage volunteers to be dynamic, courageous, compassionate, and inclusive. Every day I hear stories about how our work impacts upon people facing a crisis and how our teams live these values through the care and the service they provide. The dynamic way the emergency response teams have been responding to the COVID pandemic and the business as usual responses where the numbers in need of our help are increasing greatly. As part of our inclusive work in Northern Ireland, we have partnerships with the Irish Red Cross, and we are actively developing our new ways for volunteers for both national societies to provide humanitarian response to our cross-border areas. We are making sure that our service focuses on what's best for the individual and not just the correct geography that they live in. Thank you for listening, and I am now going to hand you over to Diarmaid from the Gaelic Athletic Association, and he will introduce himself. Thank you.
Thanks, Lea. Morning, everyone. Hope you're all well. I noticed a few names that I recognise in the participant list there, so hopefully we'll all pick up something from this morning's not only the workshop but the entire conference, and even this new platform that we're using is fantastic. Just thinking, myself and Lindsay and Lea have been chatting since last December, and I have never met them yet, apart from virtually. So it's just the way of the world, and I suppose it's maybe part of the theme of this workshop and how we've come together as 3 organisations to provide the volunteer response, as you'll find out shortly. I'm Diarmaid Marsden, as Lea has mentioned, Head of Club and Community Development for Ulster GAA. Our department covers club support, community outreach, health and wellbeing, promotion of language and culture, and most importantly for today, providing support to our volunteers that are on the ground across our club units. The GAA is one of the largest amateur sporting community and cultural organisations in the world. The Ulster Council of the GAA is the provincial council and governing body of the GAA in Ulster. We focus on our volunteers, but our unique amateur ethos is probably one of our greatest strengths, and that we're not a professional or sporting organisation. We do promote our games, and that's predominantly what we're about, promoting games at grassroots level, but up through counties and provincial level as well. We do cover 2 political jurisdictions in Ulster GAA, and we work with 9 county committees and 373 clubs across the province of Ulster, as well as 1,500 schools, colleges, and within that network we would have 250,000 players, stroke members, stroke volunteers that we try and provide support to. As you'll find out, the three organisations are all different in their setup and different in how they work with volunteers and manage volunteers. Our GAA club is the heart of our communities, and that's the core of our business, providing those healthy pastimes for our members, not only in rural but semi-rural, cities, urban environments. And we do sit in the structure that's sort of governed from Croke Park in Dublin down to our provincial councils, to our county boards, and right down to the clubs that we've mentioned. And at all levels in that association, we have volunteers, and we rely on volunteers for our administrators, our presidents, our board members, our county committees, our club committees, match day stewards, our coaches, everyone, and our players are all volunteers. And as I've mentioned, our amateur status, and the fact that we're driven by volunteers is our greatest strength. But it's in those clubs that we see the real strength of the volunteering, whether it's maintenance of club facilities, the fundraising efforts, the coaching of teams, the washing of jerseys, the providing refreshments. There's a role for everyone. And in recent years, and Scott mentioned it in his presentation there at the start around youth volunteering, that they've noticed that in Australia. We have noticed that over the last number of years as well, with tremendous examples of youth volunteering in our clubs, and again promoting those 3 R's of volunteering. Of course, all our clubs will say they could do with more volunteers, and some people within clubs contribute more than others. But every hour volunteered is welcome by each club, and that's how we operate. But we do need to be aware of volunteer burnout as well, which we need to be mindful of, and that's where we come in as a provincial body to try and provide that support and how we can look after and acknowledge and support our volunteers. I suppose the impact of GAA volunteering outside of a club network was realised during the months of March, April and May 2020. The outside of the pandemic, where practically every GAA club across the country mobilised a volunteer team to provide medicines and messages and groceries and do jobs for those that were really, really isolated, that were vulnerable, elderly, and simply couldn't leave the house. And that really put us on a good platform to suppose to be asked to take on additional roles because of that network of club volunteers. So that was one example of how our volunteering reached across or reached beyond the club environment. So that's what we do. We are a sporting and cultural organisation, but we're totally dependent on volunteers, and we were delighted. And I suppose going back to last December, when we first came on board as a partnership with the British Red Cross and Volunteer Now. So I suppose we're just going to launch into what we did and how we did it. So maybe if we could the next slide, Louise, please. And that's, I suppose, an infograph of summing up of what we delivered in the 7 months when we worked as a partnership, and we're still working. We still regularly meet up since the 31st of July, when we officially stood down from the mass vaccination centres. If you take a look at that slide, it shows that the partnership worked together to deliver right across the mass vaccination centres that sort of volunteer role that was required, and how we done that. As you can see, we went from January 2021, but probably even before that, right through to the 31st of July. 435 meet and greeters were engaged in our programme, and that's across the 3 organisations. And that was equivalent to 45,000 hours of volunteering, which is massive when you think about that. The number of doses that were sort of overseen by our volunteers, as they sort of met them and greeted them and brought them into the centres and showed them where to sit down and where to queue and made them feel at ease. 2.28 million doses as of the 31st of July, and we'd done a quick look there yesterday or the day before, and that's well over 3 million doses of vaccine that have been administered, and certainly we feel that we made a great impact in the safe rollout of that. But now, as we see, they're still being delivered and administered in the in local community settings, whether that's in the GP surgeries or pop-up clinics or pharmacies, whatever. So, it does encourage me and always makes me feel proud to see the impact of this program and how the three different organisations work together to make sure we could respond to the ask that was made of us back in November and December of last year. Could we see the next slide, please, Louise? We're all going to take a role in going through the various aspects here. And forgive me if I'm reading out a few things, but we did do a bit of work on this towards the end of the summer and early September in terms of how we just the detail how we came together and what we delivered and what made it so successful, but also the challenges associated with that. In November 2020, at a request of the Public Health Agency, Volunteer Now and British Red Cross were approached to see could we put a proposal on how the voluntary community sector could support the mass COVID vaccination programme. We were called in as well because I suppose we looked at the whole province and the whole country, and to make sure every area of Northern Ireland was covered, and how we could do that. And we figured between the three organisations that could work. We were made clear the roles would be meeting and greeting, and essentially making those vulnerable people who maybe hadn't been out of the house in months and months feel at ease when they came to the mass vaccination centres to receive their vaccine. But there was a lot of work that had to be done in the background to make sure that this was governed and rolled out properly. And that took many meetings. Last December, I was looking forward to a nice, easy roll into Christmas, but didn't happen like that. I can see the two colleagues are shaking their heads as well. So, between early morning meetings right through, I think myself and Lea found ourselves in South Lake Leisure Centre in Craigavon 2 days before Christmas, having a run through of what the volunteer roles would entail, and to see how we can then transfer that and make sure that we can develop a robust guidelines for our volunteers and what's expected of them and how they can keep themselves safe. So that's how we sort of came together. And as I say, with the online functionality of Teams and Zoom meetings and everything else, we were able to meet fairly regularly in the build-up and develop all the necessary governance that was so important in making sure this was delivered safely, and making sure our volunteers were looked after properly as well. So I suppose the steering group was involved, my colleagues on the call here, as well as others within Volunteer Now and the Red Cross, and we had constant communication with the Public Health Agency and the Health Trusts and the Department of Health in the lead up to this. It was decided fairly early on that Volunteer Now would be the lead partner, and I think in a partnership arrangement, there has to be one point of contact for the likes of the PHA and the Department of Health. So that was Denise one. Thankfully, Volunteer Now through their CEO Denise Hayward was able to take on and really done the heavy lifting at the start, and we sort of fell in behind that. But that's so important in terms of this collaboration work, that there was a lead partner and someone for the PHA to link directly with. And in terms of our steering group, then that we met 2 or 3 times. Certainly, it was every day. Then it was 2 or 3 times a week, and then gradually it became weekly meetings. But the roles around governance, how we select our volunteers, training for the volunteers, risk management, financial accountability, a memorandum of understanding had to be developed, monitoring, reporting, evaluation, all those things had to be brought together to ensure that this was done properly and professionally. Then we linked directly with the clinical leads in the vaccination centres, which again, every centre was set up differently. So it was important to go out and meet with those clinical leads to see what the setup was and what their requirements were. Because some of them did have volunteers, some of them had additional staff that other vaccination centres didn't. So we had to work around that decide the best plan of action around that. In terms of insurance and risk, we all have our own sort of employer liability insurance, but when we're dealing with volunteers, it's slightly different, and each organisation was different in that respect. But we were able to get it set up that the Department of Health was able to provide indemnity on a temporary basis for those providing a service as part of the health system of health and social care. So that was important, certainly for us as the Ulster GAA, and that our own insurance from Croke Park simply wouldn't cover that. It covers us delivering obviously volunteer roles within a club and county setting, but this was a new addition to that, so we just had to be careful around that. And once we got going, I'll talk more maybe about the setups as we go through the later stages, but we had to find a way to bring all this together. How could we engage our volunteers, notify them that shifts were available and get them signing up to shifts? And I'm going to hand over to Lindsay now, who will touch on the system that Volunteer Now brought to this, and without it, I think we would have really struggled. So Lindsay, would you mind taking on the Better Impact side of things?
No problem, Dermot. Louise, could I ask you to move on to the next slide, please? So what I've done here is a screenshot of what our system is, what we call Impact, and it's really just to kind of give you a sense of the platform that we were using. As Dermot said, we had all of our pre-existing volunteers from each of our 3 organisations, plus, given the scale of this project, that we had 6 mass vaccination centres. Some of them were operating 7 days a week, 12 hours a day. Each of them, as Dermot has alluded to, had different requirements in terms of the number of volunteers that they needed on site. So we needed a system that we could all use, that was easy, and that would allow us to communicate with all the volunteers. So we had a pre-existing system that we used. It's called Better Impact. The screenshot is there, and we've been using this since 2013, and it is exclusively for what we would call event volunteering. In 2013, we had a small event called the World Police and Fire Games, where we had 5,500 volunteers involved in that. So when you're dealing with those sorts of numbers, you need a bespoke package that will enable you to communicate effectively with those and to organise what we would term as shifts. So volunteer, the times that you would be volunteering and the days we term as shifts. So we brought this package to the table to have a conversation with British Red Cross and Ulster GAA to say, look, this is a system that we have. Can we have a look at it? Can we show you what it can do? And would you be happy if we possibly use this system as a means going forward? So it involved us kind of sharing the information, taking members of staff from both organisations through our platform to show them what it would do. And once we did that, we were in agreement that, yeah, this is the way to go. It's already sitting waiting here. We don't have to buy something new. And we needed to respond to the request from the Public Health Agency as soon as we possibly could. So Better Impact, the platform that we used, we trained up the staff within each of the organisations to go in as administrators to the system, and the system itself allows us to be able to, so for pre-existing volunteers, we can, with permission and consent, put them onto the system. So we were able to move across volunteers from British Red Cross and Ulster GAA onto the one platform under the vaccination centre umbrella. So it was a complete group of volunteers, if you like, under that auspice. We then needed new volunteers. As you would know, when a project runs this long, we needed to replenish and refresh volunteers as well. So this system, again, allows us to have people kind of in waiting. So if you're someone who is interested in volunteering, you're in a different section of the website. And once you've gone through your volunteer interview and we're happy and you're ready to start volunteering, you as a volunteer are then given permission and access to the site. And what that means as a volunteer, you're able to set up your own profile with your own photograph, and you can put in your contact details. And also then it allows us to log any achievements, any training that you have participated in, and communications as well directly with those volunteers. So the system itself was there for the 435 volunteers. And what that allowed us to do was to pull off those statistics that Dermot had talked about. It meant that we were able to see quite clearly, and we were able to set up on the system the number of volunteers that we needed per site per day, the hours attached to those specific sites, because everyone was and this system allowed for us to build that system in place that we could see every single site, volunteers that were needed for each day, the number of hours we needed for each site for each day. So we would call that shifts, just so that to make you aware of that. And then once we were happy that we had that in place, it went live. And by that, I mean volunteers were then notified. So all volunteers that were registered to volunteer on this program were notified shifts for all of the sites are open today. And we normally open them a month at a time. Then as a volunteer, you're able to go on and you're able to book your shift. So you have control as a volunteer where and when you want to volunteer. And the amazing thing about this partnership, and the one thing that I truly love about it, is that we weren't predicated to, oh, well, you're a volunteer, now volunteer, so therefore you only can volunteer on a certain site. This was open to all of our volunteers collectively. They could volunteer in a site that was closest to them or that they wanted to get involved in. And so we were able to communicate directly with them. They were able to book their shifts. We were able to deliver line through this platform, which was great. But we were able to pull out reports as well. We're able to see any gaps. So every morning religiously, the first thing we would have done is go in, let's look at the system, let's see the volunteers that are there, and let's see if there are any potential gaps in the week. Then we can contact volunteers to say there's a gap and would anybody be available. So the system itself allowed us to give an overview of the complete project, which was fantastic, and something that was really needed when we didn't have the luxury of time. We needed to deliver this project, and we needed to deliver it as soon as we can, and Better Impact was the system that we used for that. So I'll pass back to Dermot, who's going to talk a little bit about the challenges and successes. And if I could ask if we could move on to the next slide, please, as well.
Thanks, Lindsay, again. Yeah, sort of previous to that, there was a line there on communication. And I suppose that when we talk about communication within the partnership, there's internal and then external. Internal, I thought we communicate very, very well, and that was down to our regular meetings and updates, and it was easy to pick up the phone and get a quick chat if something needed to be done. And I also want to pay tribute to those, I think they're both on the call here as well, Sharon Hockey Grimley and Raquel from Volunteer Now.
Don't forget about Pierce. Don't forget about poor Pierce, even though he's not on the call.
Was covering things back in December, January, and then Sharon came back and took over from that. I don't know if anyone else from the British Red Cross, Leah, but without that sort of hands-on approach from those on the ground, this would have been much more difficult. So internally, I thought our communication was very, very good. Externally, I think we could have done more. And as Lindsay touched on, in terms of when the thing dragged on, not I wouldn't say dragged on, but when it went on so long, some volunteers and went back to work. Some when restrictions lifted, did other things to do. So we found a reduction in the number of available volunteers. If we had a bit more proactive in shouting from the rooftops of what we're doing and saying we're involved in this, would you like to help? I think we would have got more volunteers involved or interested. But again, that's one learning, I think, from a communication side of things. In terms of the rollout, as has been mentioned, we worked across 6 mass vaccination centres, and that was, again, we split them up based on maybe where our volunteer strengths were. So in the west of the province, we would have a strong number of GAA clubs, and we said we'll really try and cover the rollout in Oma and in Enniskillen, and that proved to be the case. We were able to mobilise some of the local clubs there, and through a bit of engagement with them and training as required, we were able to cover that. And that was likewise with Volunteer Now looking after Craigavon and Ballymena, and British Red Cross looking after Belfast and the Foyle Arena. But as Lindsay said, we weren't restricted to just operating in those, so we've done a bit of crossover. And I know there was other organisations. I know that some of the trusts helped out. I think at Craigavon, the Southern Trust looked after every Monday there, and we sort of helped out in Foyle Arena on a Friday, and different things were worked around to make sure that every volunteer shift was covered, to make sure, and again, the key thing of this was making sure that the people coming for their vaccinations were coming in and had a safe and I suppose, I wouldn't say enjoyable experience, but that they got through it, because some of them were genuinely concerned. So that's what we did in terms of the rollout. We had some wheelchair users, and just thinking of Geraldine McGarrigle, one of our volunteers, who ended up being one of our team leaders up in the Foyle Arena, and was one of our most committed and dedicated volunteers, who was able to be there most days when required. And loads of examples of people that contribute massive amounts of volunteer hours right across the 7 months. Some names just kept seeing every single week, maybe 2 or 3 times a week, and that was again back to that better impact system that Lindsay mentioned in terms of how we manage this and how we kept an eye on our volunteers and their volunteer workload. So in terms of some other challenges, I suppose our resources were stretched right at the start, because before we sort of laid this to our volunteers, we needed to get a handle on what was the roles and what they entailed, and each centre operated differently. So we needed to know exactly what we were asking our volunteers to do, and not develop the guidelines for that. But we needed to engage our staff members who had other roles going on, so that we're thankful to them, particularly in that early part of the year when we needed to be really hands-on with most things. And then as things progressed, we were able to move some of our volunteers into team leader roles, etc., and make sure everything was covered and delivered safely. Sometimes getting shift patterns and rotas out to volunteers was as a challenge, as this could change at times, but we overcome that. We talked about getting more volunteer shifts filled, and we had to put out some calls to our clubs at certain stages. And I know Volunteer now and the Red Cross done similar as we went through the 7 months. But overall, I would have to say it was a success. I think the partnership working together to coordinate this emergency response was excellent and was timely, because I think PHA and the Trust may well have struggled without that volunteer help, and that has been recognised by certainly the Minister for Health and the various trusts as well as the PHA. As I said, back to the stats, with 435 volunteers assisting across the 7 months, those 45,000 hours of volunteering, which is massive. And we've shown that we can work together to assist in things like this in the future. So that's my wee bit done. I think Lindsay is another slide or two just to finish off. I know we're pushing on for time as well here.
Yep, no problem. Thank you, Dermot. Yeah, we've just a few wee things that I do realise we're approaching our time limit, so I will be speedy. Just the slide that you're seeing there was actually some comments that were taken from the Care Opinion survey that was put out by the trusts. So that goes out across the trusts, and it's really about the customers coming through and their experience of the vaccination centres. So we thought that was really useful feedback, and we shared that. So we were delighted when the trust shared specific comments that came through from volunteers. So when members of the public actually mentioned volunteering in that survey, to say thank you to them. So we pulled out that because we thought that was really important to share with our volunteers. We made that into a little postcard, and it was sent out with a package of goodies to all of our volunteers during Volunteers Week in June. Which was great, but also we got feedback from the staff as well. A lot of the clinical leads at each of the different locations said, one quote, "A massive thank you, the team of volunteers, for your help at the vaccination centre. We really couldn't have done it all without you. The volunteers were so professional, friendly, kind and efficient, and really did impact on the smooth running of the centre. They should really feel proud of themselves of what they've achieved and the role that they've had during the pandemic in helping keep our community safe." So it was really valued as well by everyone. Could we go on to the next slide, please? But also our volunteers, we wanted to hear from volunteers, and it wasn't just a case of hearing from them at the end of their volunteering experience. Every at the start of every shift, we had a group meeting for each of the volunteers before they were out at the vaccination centres. So they got together to kind of give a briefing of the day and what they were to expect during the day. But at the end of their shift, they would have had a debrief. So that was an opportunity for them to give feedback about their experience that day, if there was anything that they noticed or any issues, any concerns that they needed to report on. That would go to the volunteer team leader who was there looking after them. And then depending on what that would be, it would be fed back to the organisations, ourselves, but also maybe directly to clinical leads, depending on what the issue was. So volunteers were feedback at the end of every shift, which was really important. But in addition to that, we carried out 2 surveys through the course of the volunteering experience over those 7 months. And this is just some feedback, which I won't take the time to go through in terms of some of the final survey that was carried out for all the volunteers that were involved in the project. So we've had some lovely comments back from people just saying, I really love being there. It made me feel like I was doing something worthwhile by communicating and helping others, to put a smile on someone's face, and even though they were afraid of what they were about to do. And also what we found is, one of the other quotes was about an elderly lady who came in who hadn't spoken to anybody in a year. And that wasn't uncommon. So our volunteers were there to be that friendly face, to have those chats and have those conversations, which then allowed the health centre staff to do their job. That allowed the nurses to get on with the vaccinations. And we were there to kind of provide that additional support. So we're so proud of everybody who was involved, and we are planning a thank you event for our volunteers in spring 2022, when hopefully, with fingers and toes crossed, that we're able to bring 435 people together in a space to do that, and to do that well. I know we're running short of time, but I would really like it if we could show the video. This was put together by 2 volunteers, and it kind of gives you a sense of what we were talking about. So if you please bear with us, it's only a couple of minutes long, but it kind of gives you a sense on what they were involved in. If you could play the video now, please.
Okay, I think that is us all rounded up. There's a Q&A, a question in there from an anonymous person. So if you don't mind, because we're literally running 2 seconds, so come find us and we'll answer that. Unless we're allowed to stay in here. Are we allowed to stay in here? I'm not 100% sure whether we are or not. It's very hard to tell. Well, anyway, listen, I'll talk just while it's there. So it says, how did you overcome individual organisations' policies and procedures to work together? I suppose I'm thinking about what learning. So we rewrote them. So we came together and took pieces from each of our policies and procedures, and we wrote a volunteer guide. We wrote memorandums of understanding. We wrote role descriptions together. So we were working, that's hence why we were working to burning the midnight oil on a lot of occasions on the run up, because we had no choice, because we needed to pull everything together into one document. So to whoever that was that asked that, it's an anonymous question. So anything else to add? And if not, we will leave the presentation and head over to the main room then. And I'm assuming then the tech person, Louise, will kick us all out.
Thanks, everyone. That's been great. Do you have any final words, Lindsay?
No, just to say thanks everybody for coming, and hopefully we've kind of shared a bit of our experience. I have to say, finally, it has been a wonderful partnership. It's something that we're incredibly proud of, and all the partners that were involved. I see Kate's on. I just seen a comment from Kate from the Southern Health and Social Care Trust. We did have other partners that helped, and the volunteers down there, which was led by the trust, was fantastic and a great addition, and a much welcome addition to our volunteer team. We were also supported by the Rotary Club and other members as well. So it was a great team effort, and it's something that we're incredibly proud of our volunteers of. They give everything, and we're so incredibly grateful to them. So we can't say enough about them, but we just wanted to be able to share that with you, to say, look, we have amazing volunteers here. We have guys that will step up and will do more, and even more. And even now we're still getting feedback from those volunteers saying, when's the next thing? We want to do more. So we have amazing people that live in this country, and we need to shout about it more. So thank you for coming to the workshop today, and hopefully you've got a little bit of our experience out of it. Thank you.
Thanks, everyone. There's now a networking break back in the main room. So and navigate your way back up to the main room. We really appreciate you joining this workshop, but enjoy the rest of your conference. Thanks all.
Thanks very much, everyone.
Thank you.